Okay, so this is a fresh elk heart, not preserved, so it looks different than the preserved hearts that we've seen. I've already dissected it. I'm going to go through the external structures first. So this stuff is the adipose tissue. All the squiggly indentations are where the coronary vessels are that supply the blood or the heart with blood. The adipose tissue helps cushion and support and insulate and protect the heart all along here. The anterior view of the heart is going to have more of a diagonal view that you can see. This structure right over here would be the left auricle. This is the left side of the heart. This is the right side of the heart. So this is the right auricle, the left auricle. This would be where the ventricle would be on each side. And this is actually the pulmonary trunk. It always goes across the front, so I have a tongue depressor in there so you can see that it goes in there. The vessel that is posterior to that would be the aorta, and that's usually a really big gaping hole like that. If it's branched out more, you can see how it branches as well. So the pericardium has been removed. You can see a little section of it here. And then if I take and I just go across this very top portion, that would be the epicardium, which is the visceral layer of the serous pericardium. So I think that's about all we need to see on the front for the external. If I flip it over, here's what the posterior aspect looks like. So again, adipose tissue here, and it kind of goes more straight down. For the vessels. I have put my tongue depressor into the superior vena cava, and if I turn the corner here, it will come out the inferior vena cava. So then your pulmonary veins have kind of been cut off, but they would be going in this corner. So that goes into the left atrium and the superior vena cava and the inferior vena cava, and then the coronary sinus is inside. But those are all of the external structures that you need to know, I think. So then, if we trace the pathway, we'll leave it this way. Blood comes back, deoxygenated blood comes back from the body. If it's above the diaphragm, it goes through the superior vena cava. If it's below the diaphragm, it's going to go in through the inferior vena cava. If it's from the myocardium itself, it's going to go in through the coronary sinus. And then all of those will empty into the right atrium. So this whole area here is going to be the right atrium. And if I looked at just the lining inside, that glossy part that I talked about, that's going to be the endocardium. Okay, so there's 3 layers outside. Epicardium, if you look here, it kind of looks like steak that needs to be cooked, if you will. That's the myocardium. And then the shiny lining is the endocardium. Okay, so blood's going to go in from the body, deoxygenated, into the right atrium. And then it comes down through this valve that has been pulled apart because I cut through it. But this flap right here is going to be part of the atrioventricular valve on the right side. That's the tricuspid valve. And then the blood goes down into this side, which is the right ventricle. The right ventricle is going to have this moderator band. That's how you know it's the right side, if you can see that. It also has connected to this valve, we have those are like the heartstrings, and those are called the chordae tendineae. They come down and attach to the papillary muscles. So when the papillary muscle pulls, contracts and shortens, then that's going to open that valve and allow the blood to go down into the right ventricle. So the atria receive blood and the ventricles give blood. So they're going to be the pumps. Now if you look at the whole thing, you should be able to see that this side is much thinner. If you look at this thickness here, it's much thinner than if we look at this side, this is much thicker. So the thicker side, the bigger side is going to be the left ventricle, and the smaller side is going to be the right ventricle. And it kind of flops open a lot more than the hearts that you dissected because it's not preserved. So blood goes in to the right ventricle. And then when that valve slams shut, it can't go that way. So the blood has to go, get squeezed from the myocardium, that right ventricle, and it's going to go up through this kind of back door right here. And if I follow that, I'm going to get to this tongue depressor that we looked at in the front, which is the pulmonary trunk, and that's going to branch off to the pulmonary arteries. We're going to take our deoxygenated blood and bring it to our lungs, drop off the carbon dioxide, pick up the oxygen, and then head back to the heart. So coming back to the heart, we're going to have 2 pulmonary veins from the right lung and 2 pulmonary veins from the left lung, and those are going to empty into, where I have this tongue depressor, into that left ventricle, or left atrium, sorry. So this big pouch here is going to all be the left atrium, okay? And you can see right here, here's one of the flaps for that valve. Here, again, we're going to have those chordae tendineae that attach to the papillary muscles down in the left ventricle. So left atrium through the bicuspid valve to the left ventricle. The left ventricle is going to squeeze. This has slammed shut, so now we can only go this direction. So now we have this valve, which you can kind of see right back in here. So we have these different things. There are no strings attached to this one. And it's, again, a one-way door. Those valves are going to prevent backflow. So this slams shut and does not let it go back into the left atrium. This squeezes and pushes the blood up through here, which is going to bring us back up to this one, which is our aorta. And that's going to take the oxygenated blood to the body, drop off the oxygen, pick up the carbon dioxide, come back through our superior vena cava, our inferior vena cava. If we're talking about the myocardium itself, this is our septum. So if I ask what layer is that, you would say that layer is the myocardium. But if I ask what structure is this, then you would say that's the septum. It's the septum between the ventricles, or if it's up here, it's between the atria. Looking at what else. So this pointy part is the apex. That's going to point towards your left hip. The blood for the heart itself, that myocardium, it's going to leave in the aorta. It's going to branch off into the coronary arteries. That's what's going to show all these indentations, the coronary vessels, after it drops off the oxygen to the myocardium itself so that the heart can pump the blood. Then it's going to head back and go in.